Thank you very much for bearing with us for a long time, and we would like to now have the closing remarks. We would like to now invite Dr. KAZUTO IHARA, Administrative Vice Minister of Health, Labor and Welfare. The floor is yours. Good afternoon. My name is IHARA. At the end of the session, thank you very much for giving me the time for the closing remarks. And this is exactly our initiative and momentum for the global drug discovery. On a personal note, 30 years ago, I was based in New York, and back then, my assignment was that it was about the timing when the Japanese pharmaceutical companies were to make an entry to the US, and my work was to support their activities. The overseas sales ratio of the pharmaceutical companies in Japan were roughly 20% or so. And exactly at that time, Aricept of Eisai, this is lecanemab. This is the previous drug of lecanemab for dementia, and this was launched in the United States. And finally, the Japanese pharmaceutical company was recognized for its presence. This was about the time for that. So as an expat living in the United States, this was something which was uplifting for me, and which was something I was able to be proud of. So with that background, the pharmaceutical companies started to go global. But last year, Japanese pharmaceutical companies' overseas sales ratio is exceeding 2/3 of the total, close to 70%. So from that perspective, it seems like it is such a long path that we came through. Back then, basically lifestyle related diseases, small molecule drug development was the mainstream. But over 30 years, messenger RNA, we have different kinds of modalities at the moment. And the pharmaceutical industries presence is dramatically changing. When I was in the United States, mega pharmas were having a so-called hegemony in the industry. So there were consolidations of mega pharmas. Unless they were large, it was difficult to launch new product, to do R&D activities. This was considered to be plausible. But now, of course, there are large companies. But just like today's theme, ventures are delivering the triggers for the cutting-edge products. The modality is now changing. That is shaping up the new pharmaceutical industry. So from that background, going forward, this is not just Japan, but for the global pharmaceutical industries. If we think about the R&D in this industry, together with the venture companies, how can we commercialize the technology? That will be the challenge for us. Today, we had Minister Takemi from MHLW and from many related parties. We heard about the current status of regenerative medicine in both Japan and overseas. Out of the global market, Japan has the longest longevity. We say it is the era for 100 years. Those people who are exceeding 100 years are reaching 100,000 people. So under such circumstances, from our perspective, the public for the innovation of healthcare. How can they be commercialized to the pharmaceutical products? That is strongly expected from the general public. As you know, in Japan, we have a universal health coverage system, and over 120 million people,
応じて
depending on the level of income, have the access to the leading edge healthcare. This is very rare, and we are blessed with such system. How can we maintain this system while we pursue and enjoy the cutting edge healthcare system? The government officials, including us, should challenge that. And in order to succeed these advantages, at the same time, we work on the medical insurance scheme, innovation. How can we maintain the momentum for innovation in Japan? It's extremely important. Especially, we often hear about drug lag and drug loss. And under such circumstances, we need to revisit them seriously. For example, with the NHI drug price revision, we have also done the revision for the new drug price, and also for the pharmaceutical regulation. The innovative drug should be launched to the market as soon as possible. And spearheaded by PMDA, we are addressing that issue. Given the situation 2 months ago, at the end of July, at the Prime Minister's office, to be able to contribute to the global citizens, Japan should become the hub for drug discovery. So drug discovery summit was held, and Prime Minister Kishida spoke about the creation of a drug discovery ecosystem, and he made commitment on that. With that attitude, we are trying to build global drug discovery ecosystem. And this was mentioned by Minister Takemi earlier, and here the examples have been cited. One of them is that both domestic and overseas pharmaceutical companies and venture capitalists and the Japanese government should join hands together to have the private and public council to discuss on that topic. We're planning to establish that next year. Another point is Japanese academia. They have many seeds. Without knowledge of the people and without being able to commercialize, it is a time-consuming process. To ensure that these will be commercialized from the stage of basic research, we need to have the public support as a focus for the private and public partnership. To be specific, in order to accelerate for cancer and others to academia seeds, we need to provide a fund, and this is something we would like to promote. Also, for regenerative medicine, to be able to cope with the innovative modalities in Japan, first in human test structure should be established, and we need to have the domestic manufacturing structure. Training using production facilities should be utilized to develop talent for manufacturing. Today, in the sessions you had today, I'm sure information was provided, but as the Japanese government, unprecedented drug discovery initiative is something that we would like to work on. So for these series of projects, we would like to invite your interest and understanding, and from your position, we would appreciate that you would participate in this drug discovery ecosystem. Thank you very much for your attention today. Thank you very much, Dr. Ihara. Now, with this, we'd like to conclude today's event, Nikkei Forum, Investing in Japanese Regenerative Medicine. Up until 6 p.m. JST on the 4th floor foyer, we are going to hold a networking session where beverages and refreshments are available. Please participate in that. And if you are participating, you can see the staffers who are raising a hand at the doors in the rear of this venue. Please exit from those. And if you are leaving, not participating in the network session, please exit from the doors on the left and the right. Receivers for simultaneous interpretation, please return it to the staffers close to the doors if you are participating in networking session. If you are leaving, please return it to the registration desk. Thank you very much for taking time out of your busy schedule to participate. Please have a safe journey back to your home.